Hip dysplasia is basically the underdevelopment of the acetabulum or the hip joint together. They can have pain with sitting and standing and doing activities, and then pain after those activities. And it's a condition that can lead to dysplasia, osteoarthritis, and the need for hip replacement, which we're trying to avoid. Patients are ready for periacetabular osteotomies or PAOs when they're basically in pain and it affects their activities of daily living or activities such as sports or high-end recreational activities to keep themselves happy. The most common group of people that we see is usually somebody in their teenage years or in their mid-20s. There are two goals. One is to get rid of the pain, which is the most important one in the acute setting. And then long-term is to avoid the development of end-stage osteoarthritis of the hip. This is a decision that is made between the patient and the physician. And one of the things that I try to approach this problem with is making it a joint decision and making sure that all questions are answered. It's an elective surgery. There's a reason for it. If they think they have this condition and feel like they need more questions answered, we always will answer them. We have a comprehensive team that's dedicated to trying to get everybody back to their activities, and we have a multimodal approach to pain management. We have a full service of inpatient nurse practitioners and physical therapists that are interested in helping people get back to their activities.
I think we're really lucky that we have Dr. Kane here. He's great with the patients. He really takes his time to understand what the patient's needs are. I would highly recommend him to a friend or family member if they needed this surgery. Dr. Kane will visit the patient daily and just make sure everything is on track. We have great nursing staff here, and we're in close contact with them throughout the day to make sure that patients' needs are met and that their pain is well controlled and they're reaching all of the goals that they need to reach before they're able to be discharged from the hospital. When you wake up from the surgery, you'll have an epidural in place. That will be managed by anesthesia for the first day or so post-op. When the epidural comes out, you'll be started on oral pain medications. We like to have physical therapy start as soon as possible after surgery. It could be, if your surgery is in the morning, it could be later that afternoon. The patient will see the physical therapist every day for working on getting up and walking with your new precautions, getting up and down stairs if you need to do that. The occupational therapist will be working with the patient daily on tasks that they need to perform every day, like getting themselves something to eat or getting themselves washed up, those activities of daily living.
Generally, by about 6 weeks, everybody's off of crutches, or at least ready to get off of an assisted device and start with outpatient physical therapy.
Patients can come to physical therapy between 3 and 6 months. 3 months is for a functional return for your activities of daily living, and more towards 6 months if your goal is a sport-related activity. We collaborate very closely with your surgeon and your orthopedic care team. We have to make sure the joint integrity has full range in all planes. From there, we start to really slowly progress strengthening. You'll be on the bike, you'll be on the mats, and then very slowly we'll progress you to more of the machine-based exercise. It's very important to make sure that you don't put the hip at risk. The hip is healing the entire time, and we're able to monitor that while we're strengthening you. We have licensed physical therapists, physical therapy assistants, and occupational therapists here. All have been trained and are ready to take care of you.
We have developed a group of folks that are involved and interested in this, and with our comprehensive hip program, I think that we can provide a state-of-the-art care compared to other institutions.